team for inviting me to come and speak to the intelligent gentlemen, ladies like you. As I introduce myself, I'm called Masaba David, and I'm the in charge of mental health services in this region. This region takes care of 3 sub-regions of this sub-region, Butabika sub-region, and Mbale sub-region. We have 16 districts and 1 city. So my appeal to everyone here is that as we have been discussing, we realize there's an increase of mental health challenges in the region, and more especially drug and alcohol use disorders are an increase amongst the youth and the adolescents. So my appeal to you is that let's go back down there and sensitize our youth, sensitize our adolescents, okay, on the right pathways of growth and development, and also to deviate from bad habits of taking the drugs and alcohol substances. My name is Masaba David. I work with the Regional Referral Hospital, Mbale, but I also coordinate mental health services regionally in the Mbale region. Our catchment area is, we have 3 sub-regions. The Mbale sub-region, Butabika sub-region, and Mbale sub-region, consisting of 16 districts and 1 city. So I do the mental health coordination in this particular region. Regionally, the mental health issues are on an increase, and majorly with the substance and drug-related issues, and this major affecting the youth and adolescents. We are aware that the studies have been done, and nationally we stand at the national statistics tell us 14 people are affected with mental health issues out of the general population, which stands for about 33% of the the national population. And out of the 32%, the studies indicate that 22.9% are the youth and adolescents. So we realize that the youth take a bigger percentage of the mental health issue challenges in the region and in the country as well. Of course, the services are available at the Regional Referral Hospital. We have a fully fledged mental health unit with staffing, competent staffing. Medicines we do have, they normally come on time, and at least a sizable number of them. Though as any other services, we don't lack challenges as well. Yes, the challenge we have is that this should be a national challenge, which cascades down to the region, of course. Mental health in the budgeting has been the least budgeted for, if we could say. And we understand we stand at 1% of the national health budget, and the 1% which runs the whole mental health system in the country, about 70% of the 1% goes to the National Referral Hospital. So the remaining 30% is shared among the regional hospitals around the country. We have about 14 regional referral hospitals that share the 30% of the 1%. Okay. Now this means that almost the money that comes down to the region goes into drugs and compromises other activities like outreaches, support supervision to the law facilities, and then school programs. The other challenge we have is about the staffing. The staffing is still wanting. In many regional referral hospitals, we do not have enough staff, and this in one or another compromises the mental health services in the regions. But also, as we move down to the law facilities, you find that we would have decongested the regional referral hospital with the numbers which are there, but because the law facilities do not have enough adequate, well-trained mental health staff, so all the patients in the region end up in the regional referral hospital, hence congesting the unit. But it's our prayer that the policymakers as well look into the, first of all, in the budget. Okay, probably they could increase the mental health budget to a reasonable amount of money that can take care of the medicines, the staffing, but also the expansion of the units. Yes, mental health medicines are very expensive compared to other medicine supplied in the hospitals. And with that budget, we may not have adequate medicines in the hospital. Yeah, as we wait for the government to probably look at increasing the budget, I would appeal to the partners in service to join the struggle and see how we can improve the mental health services in the country. Because we are sure that every human being, as long as you have a brain, you are potential candidate to mental health. And there's no health without mental health. So I appeal to partners to come in and work together to see that we can work together to see that we have a good delivery of mental health services in the country or in the region. Okay, as a preventive measure, I would like to call upon the entire community. One is to have what we call self-care, to understand, first of all, the causative factors of mental illness. As I told you that many of our youth are breaking down due to alcohol and drug use. So it would be my call to the public to see that the youth are sensitized, to see that they stop or they reduce on the use of alcohol and drugs of abuse. But also the public should also educate our youth as well to know how to cope up with the daily stressors. Yes, we understand that most of us are living in the low economic country, and this contributes a lot to the mental health challenges, but we'll live within the means and then see how we can prevent the mental health issues. Importantly, I appeal to the community, as I said, to have what we call self-care, take care of ourselves, let's have enough sleep, let's eat well. By eating well, don't have to eat meat or whatever, but let's have a balanced diet and in normal amounts. And majorly, we avoid taking alcohol and caffeines.
Thank you very much.
I have lost all the ignorance, and all what I've gone with is knowledge. That is, and I'm so grateful for God for that particular for that particular reason. On behalf of all the participants, I would like first of all to register our appreciation for having kindly invited us here. That is, we are very privileged, and I would like to tell you that you stand out of the crowd for all the organizations that have been able, that exist, and you saw us that we should come here, really. Dear participants, let's clap for I would like to thank our facilitator, Mr. Masaba David. Mr. Masaba, you've taught me a lot. I've learned how to network. I don't know, that's very important for me. Yeah, that is it, because I know the last foot soldier, as far as health is concerned, is the VHC. And since it is also political season, now you have the reason to ask all the MPs who are coming at that funeral, at that church, asking you for the vote, to tell them that mental health is very important in our country. In fact, you should assess them before they go to the platform. You said now excuse us. Most of us have a challenge, not only us, but we are just representatives of the so many Ugandans behind you there, who are going through the differences in their lives, challenges with their mental health, and then you should ask them that as you go to do the legislation. Is it okay that one of the priorities you should put on your priority list should be an increment from 1%? Is it 1%? Yes, 1% for mental health. At least for some, up to something visible, something tangible, something more Ugandan than what is there right now. So, for that matter, I have a reason to go and I vote for that kind of legislature. Don't go for money, go for things that build us tomorrow. Because if you go for the money, you're going to have the money today. But what happens tomorrow? Because if you mentally break down, it's going to affect your family. It's going to affect your child. Because they're going to put you off from the job. They say, first you get mentally fine, but Mr. Masaba, help us with that patient there. By the time, at the end of the day, it's going to affect your income. But if you're mentally healthy, the opposite will also be very true.
I'm Jacent Nawanga, and I work with the Jenga Community Developmental Outreach, a local NGO within Mbale District and Mbale City. I am the team leader for health and well-being, and I'm sure many of us are familiar with what Jenga does. And among the things we do, we also have a health department, and in health, we have different projects, including mental health. And today is a special day that we have had leaders, religious leaders. We initially planned to have today's workshop to include cultural leaders, religious leaders, and traditional leaders. Some people call them the witch doctors, but unfortunately we were unable to have one group. However, we were able to have cultural leaders. We had a representative from the Umukuka's office, and we also had the religious leaders from different churches and mosques, and the day was successful. Now, one may wonder why we chose to have a mental health training for religious leaders. Well, mental health is broad. Mental health affects all of us, and many times in our work with the mentally incapacitated individuals, we find that they come to us late. As an organization, we work together with the psychiatric ward, and the biggest challenge they expressed to us was delay in referral. And most of these patients, what delays them is they are either being prayed for, assuming that the mental health problem they have is a spiritual problem. So they are either prayed for in a mosque, in a church, somewhere, but when they see no progress, that is when they refer them to us. And in most cases, when they are referred to the mental health ward or psychiatric ward, it is usually too late. So we sat and talked, brainstormed with the unit staff, what can we do? And we agreed that calling and having a small meeting with these religious leaders and traditional leaders, cultural leaders, is the best way forward. So today's activity aimed at equipping these leaders with what mental health is. We also wanted them to know how best they can support people with mental illness. We also wanted to come to an agreement with them about the best strategies to support people with mental health issues. And I must say that though we planned for 30 people, we were able to have 25 leaders come and attend this meeting, and it has been a great success. We do not only do mental health with the leaders in communities, we also do mental health in schools. Most of the highest number of people with mental problems today are school-going children. Majority of our patients here in the psychiatric ward, they are school-going children. So because of that, we go out into these schools. Currently, we are working with the 3 secondary schools, Mbale Sis, Mbale High, and I think Oxford. But we are also working with primary schools. In those schools, we have meetings with the teachers, but we also have been invited. Our team has been invited to do an open mental health awareness teaching to the entire school, usually on assemblies. And this has really given us a good way forward. We have seen a number of children come to the unit to receive services. We have seen teachers come to receive services for issues they initially thought were witchcraft related, were spiritual related, for issues that they thought were minor, and now they know that they are not just minor issues, but they are issues that are affecting their well-being. So all in all, we see that mental health remains a big challenge. And yes, we may not be able to we may not be able to reach out to everyone, but we believe in taking one step at a time. Today we have been able to meet with the religious leaders and the cultural leaders represented. However, we plan that at an appropriate time, we shall still go ahead to meet with the other leaders, that is the witch doctors, because it is another way that delays referral for mental health services.